Welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my colleague, Sarah Yanosy.
Hi, everyone.
Sarah and I have developed an organizational intervention to help organizations and the leaders of those organizations to integrate trauma-informed practice using an acronym for the word presence. And it stands for Partnership and Power, Reverence and Restoration, Emotional Wisdom and Empathy, Safety and Social Responsibility, Embodiment and Enactment, Nature and Nurture, Culture and Complexity, and Emergence and Evolution. Today, Sarah and I are going to describe a little more about the underpinning of creating presence and looking at organizations as living things instead of machines, which is what we usually think about.
So I think would be helpful just to differentiate a little bit and define some terms that we use. And in the big picture, Sandy, you and I talk about adversity, chronic stress, and trauma really under the same umbrella. And they are different. And we can talk a little bit about the differences. But what we're really talking about is I think best represented by the concept of a scale. And Bessel van der Kolk, who is at Harvard, one of the leading experts in trauma work, he really simplifies it in a nice way, which is to think about two sides of a scale. And on one side, there are all of the things that can kind of weigh us down or tax us in some way, stressors. And on the other side of the scale are all the things that we use to cope with those stressors. And when we talk about trauma, adversity, or chronic stress, we're actually thinking about what happens when that scale tips in the wrong direction, when the stressors outweigh or overbear what we have available to cope. And that means that, at any given time, we may have fewer or more bricks on either side of the scale. So what we have to cope with and what we have that we need to bring those coping strategies to may be really different from moment to moment or day to day.
Well, maybe what we should do is define some terms because it can be very confusing. Um, Stress, first of all, right? It's one of the definitions of demands, which it's what you were talking about, demands which tax or exceed the personal and social resources the individual is able to mobilize. That goes back to 1966.
Oh,
Um, Hans Selye, who was one of the leading stress people, he said he defined it as the non-specific response of the body to any demand. And in its medical sense, stress is essentially the rate of wear and tear on the body at any point in time. And it causes changes in the structure and the chemical composition of the body, and those changes can be studied. So some of these changes then become signs of damage, and others are just the way the body is adapting to change over time. But it's a mechanism of defense against stress where this can really become quite a problem for the person. So there are different kinds of stress. And that's been broken down into positive, tolerable. So that's one side of the scale that you were talking about. And on the other side of the scale, toxic, traumatic, and what I call relentless forms of stress. Positive stress, hey, it's waking up. It's getting out of bed. It's everyday stress that occurs. Your body has to adapt to when I got to get up and you have to put your feet on the ground. You got to get up. It's changing. All your body is changing. inside when you just do that simple thing. It's getting excited by an activity you're going to do, preparing to work on a project that, that's not bad stress. That's like, keeps you alert and on target. Tolerable stress may be bad things that happen, but you're able to manage the situations with no long-term and serious impact on mind or body or social relationships. So let's get to the more problematic ones, and we'll start with relentless stress because that is far more problematic. It's the wear and tear on the body and brain that is a result of the chronic overactivity of all those physiological systems that are normally involved in adapting to any kind of environmental challenge. But clearly, these are things that we're not meant to have to adapt to all the time. And what kinds of things are examples of that? Living in poverty or near poverty. Hunger, never knowing if you're gonna have enough food to eat or to feed your children. Um, Racism, sexism, heterosexism, ageism, ableism, all of the isms are all relentlessly stressful for people because you never know when another insult is gonna hit, when another discriminatory act is gonna take place.
And
Being in jail. Yep,
they're
sorry, go ahead.
they're inescapable too. I think
Yeah,
as I'm listening, what you're like, there's no break from it. There's no escape from it.
mm-mm. No, only if you're home alone, maybe. Um, Being in jail, it is so if you ever have watched a prison program where people I mean, the noise, the constant contact with other people who you don't know or wanna know, the smells, the lack of any control over anything in your life is relentless. Trying to parent by yourself,
Mm.
having nobody else to help, having to do that not just with younger children, but also with elders. So multi-generational caregiving and having multiply challenged children or severe injury or illness in a close family member of any kind, particularly when it's chronic. All of these things, yes, you can't escape. You can't get away. You don't really have control. They're relentlessly stressful. And then the toxic stress. So toxic stress can occur with relentless stress. People can have all three of these, but we use the word toxic stress to really talk about the strong and prolonged activation of the body stress management system that happens when people are children, when they're young, starting when they're babies. And that's particularly problematic. Why? Because the brain and the body are so actively developing. And so the toxic stress can really interfere with the development of healthy wiring, basically. It's the reason why the adverse childhood experiences research is so important because it's the mental equivalent of drinking toxic water or breathing toxic air for children. And
Wow.
the effects of toxic stress exposure, things like neglect and all the forms of abuse that so many children endure, uh, the manifestations may not be seen until they're adults. So the symptoms, the problems, and that's where the disconnection has occurred for all of our services, is that we often see people as adults and didn't make connection to something that happened when they were 2, and they can't talk about it because when it was happening when they were 2, they didn't have words yet. So it's really quite difficult. And then traumatic stress, and people are probably more familiar with that. The DSM a diagnostic manual used by mental health providers defines trauma as exposure to actual or threatened death, serious injury, or sexual violence. And the way I think about it is that trauma occurs when an external threat overwhelms a person's internal and external positive coping resources. Now, there are many factors that affect that stress response, how severe the stressor is. There may be all kinds of genetic predispositions that, we don't know much about yet. When it happens, what developmental phase is the person is, how much social support do they have in their life? How much previous trauma have they already experienced? And what was their personality that had already developed? All of those things affect how somebody responds to a stress in the present. And then there's all kinds of dimensions of what constitutes a stressor. So how much life threat is there? How much loss is involved? How fast did it happen? Did the person get any chance to get ready for that? You think about these recent tornadoes that have hit a couple of the states, so did they have warning or not? How long did it last? Did it last for minutes, hours, days, weeks, months, years? Makes a difference. How much was the person displaced in their community? Did they lose their home and their whole way of life? What's the potential for it happening again? How much exposure did they have to death and dying and destruction? Was there moral conflict inherent in the situation? What role did they play in the trauma? Were they a perpetrator? Were they a bystander? Were they a victim? Were they all three? uh, and how much of the community was affected by the trauma? All of that makes a big difference.
Well, what's important for us to know about our biology as it relates to our modern society and trauma experiences?
Yeah, that's called the mind-body split. And this is really a long, long time problem. And it's really time we got past it because it's just ridiculous. It It originated for good reasons. It originated in the 16th century at the beginning of what is known as the scientific revolution. And at that time, the ancient Greek knowledge of 2,000 years was the idea that the world was a living thing, as was the human body. It was made by God and defined by Aristotle and then by the Christian church. And what that meant at the time was that you could not disagree with anything, with any of the principles that were laid out by the priests. So doctors and people who wanted to become scientists were not allowed to disagree with any of the ancient ideas about the body and the universe, because if you did, you could get persecuted and even burned at the stake. And it happened. So in 1641, this French philosopher named René Descartes, he declared, the mind and the body were separate. The mind is non-physical, and the priest can have that. That's the territory of God. The body was physical, like a machine, and it could be investigated. So the mind was the territory of religion, not of medicine. And that probably saved a lot of lives at the time. However, that position has made it very difficult for many centuries for science to really develop an understanding of anything mental. And it helps to explain why our understanding of emotional problems is still relatively primitive compared to how we understand the action of all the various body parts. And the reality is that it's impossible to separate the way that stress impacts both the mind and the body at the same time. And that's why we have to differentiate between all kinds of stress. So if you just take an example, it's really basic. Your heart rate normally, your resting heart rate is 60 to 80 beats per minute. if you start experiencing some stress, your heart rate's going to increase. And when it gets to 80 to 115 beats per minute, your fine motor skills start to deteriorate. It's automatic. You can't help it. You don't need to be sewing and crocheting when your heart beats up about 115. From 115 to 145 beats per minute, your complex motor skills deteriorate. Think of all those people out driving cars with a high, right?
Yikes.
And your cognitive function, your judgment, and your reaction time starts to go down. From 145 to 175 beats per minute, when you're really scared, your cognitive processing, your ability to think goes down the toilet. There's a loss of, there's a loss of peripheral vision. There's a loss of depth perception. There's a loss of near vision. You start not hearing things. And at 175 beats per minute or over, you're just completely irrational. Irrational fight, flight, or freeze, submission. You're even likely to lose control over your bowels and bladder. That's how, and that all is automatic. And that's how our mind and body is controlled. And we know now that when that happens to you when you're a kid and you have toxic stress, it's massively interfering with your normal and healthy development. And it's playing a role even in your genes, so that a seriously stressed parent may unintentionally transfer the effects of stress intergenerationally.
Really scary.
Really scary. And you might have seen this in when you're teaching and coaching the organizations that have adopted presence.
Yeah, what I've seen is I think our leaders have really started to understand the degree to which they can either mitigate or exacerbate stress responses in their staff. And so we talk about really simple things like how and when you send an email, what that looks like. So we're not triggering that stress response in the people who are receiving it, because we all look at, when we look at our phones at in the evening hour and you see something from the CEO, you're like, uh-oh, what bad news is happening, and your heart rate goes up. But also really thinking about all of us in leadership positions having the role of helping to regulate the neurobiology
Right.
of the people that we're serving, um, and really thinking of that as part of the job in a very different way. And we'll talk more about that, as well as some of the risks for using that machine model with organizations after the break. Thanks so much for listening to Creating Presence. We'll be right back.
In a world with trauma, adversity, and mental health deficits, your organization may be feeling the effects in its culture. Recognizing the need for safe, productive, and values-aligned organizations, Creating Presence can help to develop a healthy, biocratic organization. In the Creating Presence training model, your entire staff will learn to value human elements that characterize organizations, learn values that are solution-based and supportive, and implement new skills which will create capable leaders to meet the needs of staff and clients. For more information, go to www.creatingpresence.net. Creating Presence is managed by Lakeside, your resource for trauma-responsive care.
Welcome to Creating Presence. I'm Dr. Sandra Bloom. Glad to have you back. And I'm here with my colleague, Sarah Yanosy.
So nobody is listening to this podcast, Sandy, thinking that they're going to get a lesson on Newtonian physics. They did hear about Descartes, but now we're moving on, and it's your lucky day. You get to hear about Newtonian physics and Descartes all in one podcast. What's the difference between thinking about organizations as machines and thinking about them more as living systems?
I think I won't get into Newton, okay? I'm just not going to talk about him. But what I am going to talk about is that the way organizations are organized, they are organized as top down, that more like that authoritarian system that you've talked about, right? That military, the way the military works. And really all of our organizations, even our healthcare organizations, are organized in that way, that those at the top make the decisions and tell everybody else what to do, and everybody else is supposed to do them. They're not necessarily very good feedback loops, so that people lower in a hierarchy really don't have much say in making those decisions, and those at the top don't necessarily get the benefit of knowing what is actually happening on the ground. And the more that goes on, the more there's this gaping hole of knowledge and information. In a system like that, it's really easy to restrict your focus just to your own peer group or your own department or your budget or your board of directors, and not actually notice how everything is affecting everything else. And if an organization is a machine, that doesn't really matter. As a machine's going through being made, it doesn't really have to know all the different parts along the line, right? But if your body worked this way, you'd be dead. Every part of your body is constantly balancing itself internally and externally with the external environment. It's called homeostasis. So there is this constant interactive communication between all the parts of your body, mostly completely outside of your awareness. Decisions are being made at every level, and feedback loops occur at every level all the time. And not only that, but in organizations, they're entirely comprised of human beings. And human beings experience emotions all the time. And emotions play a significant role in what we do and what we don't do, often outside of our conscious awareness. And emotions are affecting your whole body all of the time. That's the way it works. So your conscious control over your body's function is actually pretty minimal. It's automatic, and it started before you were even born and is affected by what happened when you were in your mother's womb. It affected what happened to her intergenerationally. So what that means is that every leader of an organization needs to be emotionally intelligent, and they have to develop emotional wisdom to deal with all of the challenges that the people in the workforce encounter from their own work and their own lives. So organizations could conceivably function as living systems, but that's going to mean and require a significant shift in our understanding, like our understanding of what democracy really means. When we talk about building consensus, that's what we're really talking about. It's not just about voting. It's really about a very different way of thinking and being with each other. And it's a way of being that every leader should be using in some way with his team. Otherwise, people feel disempowered and helpless, and that just makes everything worse. You've done some work with the organizations that we're working with that have adopted creating presence, that ask them to think of themselves and their roles in their organization as part of like a human body. So what's that been like? What are you saying?
Really cool. I think we often start by really recognizing that whenever there is a problem, like a client or patient who's really giving everyone a struggle, or a program or a department where things just aren't going well, the immediate reaction is like, let's remove the problem. And so we sort of understand that that is a pretty typical reaction. Like, we see a problem, let's get rid of the problem. But usually what happens is the problem continues. And that's because we're looking so much at the system as if it's a machine with a part that you can replace. Like, oh, okay, this is a broken part. We just plop in a new part and everything is fine. And so what we've been talking about with organizations through this really fun activity is asking them to think about what part of the human body system might their role represent. So we'll ask, do you see yourself as part of the skeletal system, right? And this sometimes means going back to, like, fifth grade biology. Like, people are like, what is the skeletal system? So we clarify, like, that means the bones. Are you kind of like the bones? Like, do you hold everything upright and kind of, keep it all tight and structured? Are you part of the circulatory system? Are you sort of like the lifeblood that flows through the organization? Are you more like the immune system? Do you serve a protective process? Are you keeping the organization safe from outside threats? Are you part of the musculatory system, the muscles that do the heavy lifting and the hard work? Or are you part of the nervous system, right? Are you like the brains of the operation, or are you more like the nerves that feel everything that's going on in the organization? And then we ask people to talk about, so what I actually ask them to do is, like, go to a different part of the room that represents that, part of the system when I do this in groups. And it's fascinating to see who ends up where. And then we ask people, to talk with each other about why they chose that system and that part. And what it boils down to in the end is really kind of helping people recognize the value, and thinking about that value in different terms. And so you see people who have administrative tasks or HR roles, who, don't, they know that their work is important and it's support work, but thinking about themselves as the bones, or thinking of themselves as, the like effectively protecting from outside stressors. Our compliance officers often are the ones who are like, yeah, that's what I do. I make sure we don't get shut down. And everyone thinks I'm a pain in the what, because I'm always giving, this like really unpleasant feedback, which is exactly what our immune systems do, right? When our immune
Right.
systems encounter something awful, it makes us feel sick.
Right.
So really thinking, though, about these roles in this different way is so helpful. It also means that we are not just thinking about individuals or departments in silos. We're really thinking about the interconnection between them, because the immune system can't function if it's not getting the blood flow. And the brains of the operation can't work if there are no bones keeping the thing upright. So we're really using this analogy or metaphor to think differently about what we're contributing and what our value is, and also helping to shift that focus away from just thinking of our organizations as machines. The other thing I think that's really very helpful is that this analogy makes us think about rest and nourishment. And that's one of the things I think it's important for us to talk about too. We don't give ourselves the restoration time and refueling ourselves, we can't keep going. And one of the things that we often, talk about in the context of this activity is, what are we doing when we're having, the lifeblood work overtime all the time and mandating extra shifts, or like having, some of the stressors that are affecting, different areas. Also realizing, when the lifeblood has is overtaxed, or there's like some problem or infection that spreads everywhere. And so we're able to use this activity or concept of in comparing to the body in a way that really helps solidify a different understanding, um, not just about what happens when things go wrong, but also what we need to do differently to make things better.
Right. It's really about health, isn't it? And
Yes.
we don't really, there's talk about well-being in organizations, but without this kind of model, you can't. And it's called a biocratic paradigm, and it comes from Walter Buchanan, who's a famous physiologist from Harvard, who defined homeostasis, and he's the guy that defined the fight-flight response. And he gave a speech when he said that our society should be biocratic. And I went, oh, yes, that's exactly what it needs to be, like a body. And the result of what is going on in our culture now, I know of a very large system that just laid off 10% at every level of their people. Now imagine losing 10% of your body, right? It can't function normally anymore, right? And it affects every other part of the body. And it's the same with organizations. So it helps us, I think, to understand why people are leaving in droves. There's so much talk about burnout and moral distress. And after all, machines make products to sell, so profitability is important. But with caregiving and educational organizations and justice-oriented organizations, they're not there to make a profit. They're there to care for people and educate people and create the fairness for people. And these two models that we're seeing are deeply clashing, and it's costing everybody their personal health, and it's costing us our social health.
Well, and I think the connection to the idea of nourishment and rest comes into play there too. I mean, funding is the
Food.
nourishment
It's
for
food.
organizations.
Yep.
And often we are asking them to do far more with far less. And the body cannot survive that way.
Right.
And, over time, it becomes starved. And then when we are in some organizations, I'm thinking about, hospitals, residential programs, the 24-hour settings, there is no time for rest. And even in organizations that don't operate in a 24-hour system cycle, the pressure, I'm thinking about the outpatient clinics that I work with, the idea, they're being asked to see more patients in, more billable hours in, within the day. And so there isn't that time for reflection, for even,
Right.
a break.
Right. And when you're using that exercise and people in your sites are starting to shift, what do you see? What are the results are you thinking of that shift in thinking?
I think the most powerful outcome is the recognition of relationships as central in keeping organizations healthy. And so one is sort of like moving away from the idea of people as replaceable parts. And that's really helpful, but also the understanding of how important what happens between people is, not just what's happening within people. And I think that's, a way of approaching staffing issues and providing treatment services. A lot of times, there's a focus on like, what is the psychological issue that this person is presenting with when they're coming in for care? And what we really need to focus on is what's happening inside this person psychologically, but also what's happening in the interactions this person is having, and how can we use those interactions to shift what's happening internally for that person. And in thinking about creating health, we're also looking at what's happening between the members of our workforce and what's happening between the workforce and the leadership. And so a good example came up for me in a coaching session a couple of days ago, where a team was talking about an impending retirement announcement from someone in a very high level position in one part of a hospital system. And so they were talking about, okay, so what do we need to do to to communicate about this and support the people who are going to be impacted. And I asked the question, how are you defining who's going to be impacted? Because often that is really narrow in scope. It's like, well, the people who are going to report directly to that person, and maybe the staff members under that person. And when I posed the question, having this perspective immediately changed the conversation for the participants. I didn't have to say anything else than, how are you defining that? And they were able to say, wait a minute, we need to really think about the ripple effects. It is not just a silo, it's not just that program or department that's going to be impacted. This is actually going to affect the interactions and relationships at lots of other horizontal levels. And so we're probably going to need to change our communication strategy. So those are some of the ways that this, kind of goes from a theoretical understanding to a practical application. And that's been really exciting to see.
Yeah, and everybody has a body. So it's really some knowledge.
It's
We have some,
relatable.
even the most rudimentary knowledge, is everybody's got it. So that
Yes.
makes it pretty handy.
So thanks for listening to Creating Presence. Coming up after the break, Sandy and I are going to talk about some of the criticisms of trauma-informed care and practice, and think about another way to address that. So we'll be back after these messages.
If you want to develop a trauma-responsive culture within your organization, your leaders must be able to be knowledgeable and possess the skills to create positive change. Creating Presence, developed by world-renowned Dr. Sandra Bloom, offers an online training and coaching process that will help leaders become capable to cultivate a safe, productive, and values-aligned environment for your staff and clients. For more information, go to www.creatingpresence.net. Creating Presence is managed by Lakeside, your resource for trauma-responsive care.
Welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my colleague, Sarah Yanosy. And clearly, we're passionate about using trauma-informed and trauma-responsive practice, but there are some valid criticisms about using this terminology and focusing on the negative. So, Sarah, what criticism do you hear with our programs?
I think what trauma-informed care elicits for people is kind of a focus on the negative, right? The term itself has the word trauma in it. And so that sort of sets the stage for thinking about, the impact of trauma. And we want that. That's important. We recognize how powerful a role trauma, adversity, and chronic stress can play in people's lives. And the fact that there's been such limited attention to that has meant it's important to name it and clarify it. But it's a fair criticism that, when we call it trauma informed or trauma responsive even, we're focusing on the negative things that have happened. And so I think there is something really important about balancing that with understanding and conceptualizing the capacity for healing. We sometimes talk about being resilient, and there is some valid criticism about that term also. And what it means to think about resilience from an individual bootstraps kind of perspective, and sort of placing that expectation on members of communities who have experienced systemic oppression. So that plays into some of the criticism as well. Another criticism, which I think is more about a misinterpretation or misunderstanding about the term trauma informed or trauma responsive, is that it's really about excusing bad behavior. And I hear this criticism a lot, that in sort of highlighting the experiences that have been significant contributors in lots of maladaptive coping behavior, that what we're saying essentially is, well, just because somebody had a bad experience or a really hard childhood, it's okay that they did all of these things. And so in thinking about addressing that one, because I think that feels easiest to me, we have really built into our training and implementation process a degree of accountability for recovery and healing. And so it's easy to talk, I think, from the perspective of creating presence, that like it's actually the opposite. We are not interested in excusing behavior. We want to support people in making changes that affect their overall health, including their behavior. Now, the first two criticisms, that, the term is negative and focuses on, kind of the pejorative instead of strengths-based perspective, I think that's really true. And so you and I talked a lot about Sean Ginwright's work in healing-centered engagement, and really wanting to incorporate what we've learned about focusing on healing and centering strengths-based work as part of how we deliver creating presence.
Yeah, there are 4 components that Dr. Ginwright talks about in his work, and they I think capture such important aspects of healing and recovery. The first one is that healing center engagement, it's really explicitly political rather than only clinical. And that grabbed me right away, because it's almost like only focusing on the clinical aspects denies the fact that these are really social and political issues that are being decided, that starve our organizations, that make it very impossible for healing to actually get delivered to people. So I think that one is so critically important. And then the second component is that healing center engagement is culturally grounded and views healing as a restoration of identity for people who have been made culturally unsafe, and often morally unsafe as a result. So that, I think, is so critically important. And then Healing-centered engagement is asset-driven and focuses on, the well-being we want rather than the symptom that we want to suppress, if at all possible. And healing-centered engagement really supports adult providers. It basically says this healing needs to be for everybody, that just because you are working with people who are hurt and need help doesn't mean that you're just fine. So it captures, I think, all of those criticisms that you were just addressing. And what do you see with the sites that you work with when they're actually operationalizing healing-centered engagement?
I think the last piece that you just talked about is where I want to start. Um, Having a conversation about ACEs, adverse childhood experiences, and using some of the research that helps us understand the just the broad impact, the scale and scope of adversity that humans have experienced, especially in our country, is a really helpful starting point for our staff. And we also talk about the fact that so many people who are drawn to the helping fields are doing that because they have some lived experience. And so we need to be really thinking about and focusing not only on the stressors of doing that hard work, but also recognizing what they're bringing in from their life experiences before they even step foot in that workforce. And a couple of things that have come up as really encouraging ways of operationalizing that focus on adult provider healing has been in organizations that have set up what they call serenity stations, and they have at times brought in people to do Reiki or meditation or yoga or chair massage for their staff, really in recognition of the importance of taking care of their bodies, even in the course of a day of work. And I think on a smaller scale, when we bring food in to the break room and leave little snacks and treats and things like that, those are really small but also really significant ways of reminding people about the importance of self-care. Another thing that I think has been really interesting is the first one, and I wonder if you've encountered this too. There was a time last year when talking about connecting the clinical and the political felt like a conversation. Now it feels like a match, lighting a match and throwing it on a fire. And I am an instructor at Columbia University, this Mailman School of Public Health. And so I teach a little north of the Columbia campus, where all of the recent political protests have been happening. But I think there's something really important about what is happening in making that connection between the healing for individuals and the recognition that we also have to change the systems that are creating the trauma that people are experiencing, right? So it's not enough just to have people pass through our service providing systems and get better if we're not actually shaping or changing what is happening in the communities, in the families, in the countries, in the schools, all of the places where people are experiencing these traumatic events. we need to encourage mobilization to help. And so that's really what healing centered engagement
It's
will
not a
look like.
coincidence that we've both ended up teaching in schools of public health.
Yeah, it's so
Right?
true.
Because
Exactly.
neither of us are actually trained in public health, but but
Right.
it's
But that's,
clear that
yeah,
all of
it's,
this is about public health.
yes, yes. And I think that is also what is so important in connecting about healing centered engagement as these concepts as a way of helping move this process. Another thing I think, I've seen is with regard to being culturally grounded and restoring identity. A lot of the work that I've seen best exemplified is in Canada with our friends at Marymount, and you and I participated actually in a smudging ceremony that was really, really powerful, and I think um, it it's because they serve so many indigenous youth and families, that this is what it has felt important for them to ingrain in their practices, right? But it was originally a Catholic institution, and so being able to bridge like the tradition of being a Catholic, what, Sisters of um the Good Shepherd,
Yeah.
one
Yes.
of those, right? So having that historical foundation, but really leaning into uh, traditions and practices that are more representative of the population that they're serving, and integrating that into daily practice, really powerful. And then the other thing I've seen that's been really inspiring has been around um, that strength-based approach, and really like an asset-based approach. And where I've seen this done best is in some of our organizations where they are using artistic expression. Like they're really encouraging the patients or clients to engage in music or art that
Or
is
drama.
or drama, right? As a way of connecting with those strengths and then sharing those talents with other people. So Sandy, you and I are going to talk again next week, and we're going to talk more about what happens when little brains encounter big risks and some of the big problems that we see as a result. So thanks so much for listening to Creating Presence. You can find us at voiceamerica.com or creatingpresence.net. We look forward to seeing you next week.